I have temporary lip fillers. It's just an insecurity of mine, and it's what I wanted to do.
Yes, insecurities. Hi guys, I hope you well and everything is going a-okay with you. Welcome back if you've ever been on this channel before, and welcome if this is your first time. If you've liked the video and this is not your first time, just don't forget to drop a like and subscribe. If you don't know this lady on my screen, this is the same person before and after. This is Kylie Jenner. So Kylie Jenner is the sister of Kim Kardashian, and they have this show on TV, the Kardashians. So a couple of sisters who have just grown on TV. This was her a couple of years back. This is her today, or pretty much recently. And you can see that there has been drastic changes. So obviously she was more of a child here, and now she's a woman. But even though you grow and you change physically, your lips can never change to become like this. In the clip that we saw in the beginning of the video, she actually states that she has had fillers put into her lips. This is something she denied, then came back and said that she now has fillers in her lips. This is something today that happened a lot when people are just insecure. She's not the first one. But this family and a lot of people, the internet, Instagram has made people realize that you can get surgery for anything you want today. So let's start from the beginning. All this got me curious, and I actually went and tried to do a little research on plastic surgery. While reviewing the history of plastic surgery, I watched a video by drgarylinkov, this gentleman right here, who is a facial plastic surgeon based in New York and who also has a YouTube channel. So this is his YouTube channel. I will link the video that I'm talking about. So according to him, and this is the video he did, the video is actually called Ugly History of Plastic Surgery.
How did we get to cat eye surgery and buccal fat removal surgery? What are the origins of the cosmetic and reconstructive plastic surgeries that are available today? How are we now able to...
So, in summary, he actually states in this video that the first plastic surgery was 2000 before Christ. It was mainly done by the Egyptian, and they used to have linen cotton cloths put around their arms or their legs to make it smaller, and so many different things. This is actually something that is still being done today, by the way. In some places you can actually use linen to modify the appearance of a lot of body parts that you have. He also stated after that that the first rhinoplasty was done in India. So, well, rhinoplasty not as we know today, but sort of plastic surgery. So obviously people have surgeries or plastic surgery to better their appearance, and it started being a little more common during the World War II, World War I and World War II, because obviously when soldiers were being injured, they didn't want to stay and have all the scars and issues with their face and their body, so you get to plastic surgery. So you have what we call reconstructive surgery to make sure that you are good enough to be able to use your face, you can eat properly, you can breathe properly. But after that, you can actually still look, excuse me for the term, not normal. And this is what when you're required to actually have plastic surgery to look somehow normal. Excuse me for the term. It's a term that I don't really like using. As a teacher of mine when we were in high school said, well, what is actually normal? Because they can be an average, but normal is not really a term that we should use, and it's something since then that I try to avoid using. In the 1960s, plastic surgery started becoming a little more common because they knew the doctors now knew a lot more of it. They had the time to practice on all the people that were involved in the war, and it started actually taking a rise in America and around the world, but especially in countries such as America. In 1998, Bill Clinton actually signed an act so that plastic surgery can be covered by medical aid, which actually did not help because now people knew that they were covered at least a portion of the funds that they needed to do those plastic surgeries were now covered, and you needed less money from your pocket to actually do your plastic surgery or to have your plastic surgery done. In 2020, you had more than 20 million plastic surgery done around the planet. And most of these surgeries were done in the USA. I want to talk a little more personal side because I actually always like giving my point of views. And I remember in the beginning of the year 2000, a lot of people actually were starting to do surgeries, but it was a taboo. You had the surgery done and you didn't go and flaunt it. You tried to do it as natural as possible. Most people wanted to have procedures that still look natural. So for you to know that somebody had done plastic surgery, the person would probably have to tell you and confess, sort of, because it was a very taboo thing to do. I remember a friend of mine, the first friend that I had that was from Brazil, she had told me back then that it was something that was very common already in Brazil. All Brazilians had surgery done, men and women, she said. And I was shocked. And I asked her, what did you get done? She said, my breast. And they did not look crazy. They did not look like what people do today. They looked like mine. It was natural. It was soft enough. It was not huge. So this certainly was not happening in the beginning of 2000. So this woman here is a Canadian social media influencer that actually had 2 boobs like this. And unfortunately, overnight, one blew up and she was left with that. And she decided to just stay like that at that moment. I don't know if she altered back herself, which is quite sad because we went from trying to look appeasing to the planet to now do something that is crazy. She's poop everywhere. I mean, this is what surgery looks like in 2023 today. It was such a taboo thing to talk about that, like Kylie Jenner, Tyra Banks, and Lady Gaga, and so many stars actually talked against plastic surgery. And after that, since we're more free today, actually confessed that they had work done. They had work done themselves. So, and obviously I will put a picture of Tyra. Today we have more and more of people on Instagram doing this. You will see a young woman that will go on Instagram, see something like this, and this person probably has a huge amount of followers. And the next thing you will know, you will see the 16-year-old actually going under the knife and actually getting herself cut to just look somehow like this. Because the more you shock, the more you're popular, and the more popular usually teenagers want to be today. Officially, the age of consent to have plastic surgery in the US of A is 18-year-old. You have parents that can sign off so that their 16-year-old, 14 years old can actually get plastic surgery. So the different plastic surgeries, and I know some people are not going to agree with me, the different type of plastic surgeries are facelift, brow and forehead lift, eyelid lift, ear cleaning, ear reshaping, hair replacement surgery, nasal surgery, nose reshaping, and more. So let me actually have a little parenthesis here. This ear reshaping in France is actually free for kids because they had realized at some point that kids were really getting bullied at school because of their ears and decided to make this free for kids to have as a procedure in France. Plastic surgery has now become less of a taboo and everybody can do it. And everybody turns around and go get a procedure done just because they don't really like why their under eye is sagging because they're getting old. You will actually see 27-year-old that looks like 50-year-old people because they have gotten so many procedures done already. It is becoming almost ridiculous. Today we even have more procedures because the last procedure or the newest procedure that you now have is bottom surgery, which is require people to, depending if you're trying to become a woman or becoming a man, what they will do if you're trying to get a penis down there is that they will actually take off some skin from your forearm to actually create a penis for you. And they usually do all these plastic surgeries without really knowing what exactly is going on. We know that any surgery is not 100%. So the newest procedures out there in plastic surgery they try to not call it plastic surgery, they call it genital reconstructive service / bottom surgery. So what it is when you are a man trying to become a woman, they will actually cut off the penis and the testicles and trying to make sure that they sort of create a physical vagina. Which is still dangerous because what happens today is, as this is not a vagina, it creates a wound that has to use a dilator to make sure that the wound doesn't close down, because what it is not a vagina but a wound. You also have a woman that tries to become a man, and on that part they actually graft skin. They take skin from your forearm and they cover something that I don't know what it is yet and create you a fake penis. Those are technologies and surgeries today that are not up to date. They're not up to point. And most surgeries actually are very dangerous because so in the beginning, when they were trying to still get breast surgery, the implants, they actually tried different things. They tried silicone, they tried saline, which could actually rupture and that could actually kill the person who got the procedure. Today, we still have plastic surgery that came to a certain level that is not the worst. Unfortunately, it is still not 100%. As I've shown you, this woman, this was in 2023, who had the surgery done and got one of them actually exploded. You can get a lot of complication to this. What I actually want to say is I am actually really disappointed in doctors. By the time I was born to today, doctors are the one that save us. Doctors are the one that have the world on their shoulders. When we were actually in the period of C-19, they are the one who actually put their lives on the line to make sure that we were safe. But what I don't understand is having those surgeons today that are willing to try everything, that are willing to open your face and actually put balls in it so you can look like the devil. So you have doctors that actually do anything. They will let you look like the devil if that's what you want. They will actually change the color of your eyes if that's what you want. They will actually put too much saline in your breast if that's what you want. They don't actually take the time to tell you what are the right and the wrong thing and the limit to the surgeries. They actually try to push themselves so you can get what you want. And I think that is actually the downfall of all this, because it's not that plastic surgery is not necessary if you actually had an accident and you looked butched by an accident or natural or butched by another surgeon and they're trying to correct it like this. They don't tell you what it is anymore. They're just there to get your money. People are not trying to put on the work anymore to even lose weight, because you go to a surgeon, you get liposuction done, and all of a sudden you're skinny. You want a big butt, but you're not willing to squat. You go get a BBL. This is where we are today. And this is what the message we're passing through to the next generation. It is common, it is easy. Why don't you do it? But is it the best solution? But obviously today people want to have their freedom. They want to look as pretty as they can look. It's not the actor, the Hollywood actor, the singer that actually wants to look like 24/7 perfect. It is the Instagram model. It is the niece that actually look up to those Instagram models. And they actually do it because they get bullied at school. So the the image that you actually give to people and what they say about you is more important than you being yourself. And then you decide to become whatever you want. You want to become a human Saturn, you can become a human Saturn. You want to look like a cat, you can actually look like a cat. You want to look like somebody who has eyes that don't not human, that don't look human, you can do that. You reality star, go for it. To the point that you can try to look like them and pass. This young lady here, this is the real Kim Kardashian and this is the lookalike. Obviously, if I saw her on the street and I didn't really know Kim Kardashian, I would feel like she is Kim Kardashian. This is pretty decent when it comes to copycat. But this woman actually died. She passed away after she completed a surgery and she passed away in a hospital. Her name was Christina Ashen. You can actually lose your life just to try to look like a Kim Kardashian. And it's not looking like Kim Kardashian that will make you a billionaire. So I just wonder why people do it. Kim is a very beautiful. Kim is a very beautiful woman, but Kim is Kim. What is it today that makes us just not like ourselves? Is it that bad to actually be happy about what you got at birth and risk your life to actually look like somebody that isn't you? Anyway, tell me what you think in the comment section. You can leave a comment, you can like, or you should even actually like and subscribe. I will see you in the next one. Faceless here. Ciao, ciao. Take care.